these major entry points. Gloria Milimu, KTN.
Now, remaining with that story, as East Africa remains on high alert over renewed Ebola infections in the region, concern is mounting over Kenya's porous lake borders. In Kisumu, authorities maintain they are prepared, with Jaramogi Oginga Odinga Teaching and Referral Hospitals setting aside quarantine and isolation facilities. But on the waters of Lake Victoria, where fishermen from Kenya and Uganda mingle freely, can preparedness truly match the risk? Branbure has this story.
For many in Nyanza region, Lake Victoria is more than water. It is work, it is survival, but most importantly, it is also a meeting point. Every day, fishermen from Kenya, Uganda and Tanzania interact freely, sharing fishing grounds, exchanging goods and services, moving from one shore to another with little thought about boundaries.
Mostly the fisher folk along the islands are living in the community. So they interact with their counterparts from Uganda on this other side and from URT on the other side of Migori. So the entire Busia County 21 BMUs interact daily with the fisher folk from the Republic of Uganda.
Those connections help sustain thousands of families, yet health official says the same movement can become a challenge in event of a disease outbreak.
Tunasikia tu kwa radio ati Ebola ikiingia damu inatoka kwa mwili kila mwili yote.
Hatujui inaanza namna gani kugonjeka mtu. Maana saa hii hatuwezi kubali ingie hapa. Government isaidie sisi hiyo ugonjwa isiingie hapa.
As neighboring countries heighten Ebola surveillance, attention is now turning to border communities like those around Lake Victoria.
What happens when you suspect someone has an Ebola? Number two, reporting systems. So how do you report? How do you report, for instance, at the BU leadership that this is what has happened? So that's also a critical area, awareness of the fisher folk, sensitizing them so that they understand really what the scare is about. Then, of course, I will not forget to mention infrastructure. Take an example. If there is an outbreak or there's a suspected case in Mageta Island, is there a plan for evacuation to an isolation center or to a better health facility?
Few kilometers away, preparations are underway inside Kisumu's largest referral facility, Jaramogi Oginga Odinga Teaching and Referral Hospital.
We have 3 isolation rooms within the facility, first and foremost from the casualty and the ward. But remember, Ebola need to be contained because of the biosafety involved. So again, now we have an annex. So the annex has 6 rooms. So it has 6 closed rooms which can handle 6 patients, and also 4 general wards where you can also now, after doing contact tracing, you can isolate the patient. So that's a 13 to 14, that's a very good number for now, because we have never had Ebola case in Kenya.
You saw those wards. What we're going to do is right now, first support in terms of refurbishment, innovation, to be able, because it's within the Kemri system, for us to be able to renovate it. And then after we renovate right now, it will be ready for any eventuality.
And for the communities that depend on the lake, stopping movement is rarely an option. For the communities living on the shores of Lake Victoria, the question is not about how hospitals are well prepared, but whether the surveillance on Lake Victoria can keep pace with the daily human traffic in this region. Bramwell Bire, KTN, Homa Bay.